The two most common questions that mothers often ask me are whether they are breastfeeding properly and whether their baby is getting enough breast milk. The answer to this lies in the two most important aspects of effective breastfeeding, which are proper positioning of the mother and the baby, and attachment of the baby to the mother's breast, also known as latching. A good position leads to a good latch, which in turn makes breastfeeding a wonderful experience for both the mother and the baby. On the other hand, if the baby is not latched properly, then it can make breastfeeding a really painful experience. We have already spoken about the different breastfeeding positions in the previous video. So in this video, I'm going to talk about how to achieve a good breastfeeding attachment or latch. A good latch is vital to successful breastfeeding. The techniques which I'm going to describe, coupled with proper positioning, can help ensure a good latch. As a first step, get into a comfortable chair with a good back support to feed your baby. You can choose to rest your feet on a stool, as this will not only help with a good posture but also prevent you from putting strain on your neck and shoulders. Next, if you choose to use a pillow, it can make a huge difference in getting the baby in a proper position to latch on properly. Any regular pillow can be used for this. Later on, you may not even require the pillow. Now, as you carry your baby, make sure your baby is tummy to tummy with you at all times. Remember to keep your baby's ear, shoulder, and hip in alignment, which will make swallowing easier. The baby's nose should be opposite the nipple. The baby's head should be tilted slightly back. Next, ensure that you bring your baby to you instead of leaning towards the baby. Leaning will not only cause severe strain on your neck and shoulders, but can also affect the baby's position. Once the baby is safely positioned, then you need to hold your breast to help guide the nipple to your baby's mouth. Grasp the breast on the sides using either a C hold, U hold, or a V hold. Make sure to keep your fingers far from the nipple so you don't affect how the baby latches on. Aim the nipple towards the baby's upper lip or nose and not the middle of the mouth. You may need to touch the nipple across the baby's upper lip to get your baby to open his or her mouth. When the baby opens the mouth wide enough, with chin dropped and tongue down, he or she should latch onto the nipple. If the baby does not open her mouth wide enough, then do not try to push the nipple in and wiggle the mouth open. It is best to move back, tickle the lip again with the nipple, and wait for a wide open mouth. Make sure your baby takes a good mouthful of the areola and not just your nipple. The baby needs to have more areola at the bottom of the mouth compared to the upper part. Ensure that the baby's bottom and upper lip are flanged out like fish lips. If they are not, then you may use your finger to pull the bottom one down and open up the upper lip more. Remember that if you follow all the steps of attachment correctly, then your baby's nose should be clear of any obstruction. Achieving a good latch and position during breastfeeding has many benefits. A proper latch not only assists a good flow of milk but also ensures that the baby gets sufficient feed. How does this happen? A wide open mouth means that your baby can scoop in a full mouthful of the breast. This will draw your breast deep into your baby's mouth. Your nipple will then be right at the back of your baby's mouth. This is where the hard roof of your baby's mouth gives way to the soft area. With a mouthful like this, your baby will be able to use the tongue smoothly and rhythmically against the underside of your breast. This action removes milk effectively from the ducts and ensures a good flow. As this happens, your baby's jaw will move up and down following the action of the tongue, and your baby will be able to swallow the breast milk properly as it flows to the back of the mouth. This will ensure that your baby gets a good feed. Let me explain how a good latch also benefits the mother. A good latch ensures that your nipple will be far back in your baby's mouth and won't get squashed or pinched by your baby's tongue. Furthermore, with a good latch, your baby's lower gums will never touch your breast. Your baby's tongue will always be between his or her gum line and your breast. This protects the mother's nipple and also prevents the mother from feeling any significant pain during breastfeeding. To conclude, here are the main takeaway messages. A good breastfeeding latch is one of the most important aspects for successful breastfeeding. Sit in a comfortable chair with a good back support to feed and use a pillow to help you and your baby get into a comfortable breastfeeding position. Ensure that you bring your baby towards you and do not try to lean into your baby. Not only will this cause severe strain on your neck and shoulders, but also affect the baby's position. The baby's nose should be opposite the nipple. Hold your breast in a C, U, or V shape to help guide the nipple to your baby's mouth. Aim the nipple towards the baby's upper lip or nose and not the middle of the mouth. Your baby should latch onto the nipple with a wide mouth, chin dropped, and tongue down. Make sure your baby takes a good mouthful of the areola and not just your nipple. The baby should have more of the areola at the bottom of the mouth than the top. The baby's nose should be clear of your breast so that it does not obstruct breathing during feeding. The baby's chin should touch the lower portion of your breast. A good latch benefits both the baby and the mother. It results in a good milk supply and feed for the baby and makes breastfeeding painless for the mother. Breastfeeding is a beautiful experience, but some mothers are scared that their baby might bite them. Therefore, it is imperative to ensure that your baby latches on properly.